Can you have polycystic ovaries without having polycystic ovarian syndrome? So let's talk about that today. So whether you can have polycystic ovaries and not actually without having the PCOS, the actual syndrome. So let's dive in and we'll talk about whether it's possible to actually have that without having PCOS or polycystic ovarian syndrome. So you've been diagnosed with polycystic ovaries, but what does that mean? Does it mean that you have PCOS? Or perhaps the diagnosis for PCOS is inconclusive. At this stage, it's inconclusive and your GP or gynecologist hasn't confirmed the diagnosis of PCOS. So what now? Hello, I'm so thrilled to be here, and for those of you that don't know me, my name is Michelle Cooke and I'm a period and hormone naturopath. I'm also a natural fertility educator. I'm a NER practitioner, so a naturopathic emotional release practitioner. And I help women struggling with their menstrual cycles have easy, pain-free periods, balanced hormones, and emotional well-being. And I'm the founder and director of Reproductive Wellness, which is a clinic based in Melbourne, and I see patients both online and face-to-face. So if you have any questions or comments as we go through the live this evening, be sure to pop them in the comments box down below. If you think of something later, you can always pop it down there. If you're a bit shy, you can always send me a DM or a PM, and I'm more than happy to answer that for you. So, and as we go through as well, if you can hit the likes and loves, just so I know that you're enjoying the content, I would really appreciate it so much. So let's get started. So what are polycystic ovaries? So before we talk about that, let's talk about our ovaries. So they normally contain follicles, okay? So they're a small sac of fluid that contains our egg or immature egg, okay? So that's, there's one immature egg per follicle. And at various stages of our menstrual cycle, under the influence of our girly hormones, the follicle will develop from a primordial follicle to a primary follicle to a secondary follicle and then to a Graafian follicle or a mature follicle, okay? And then from there, of course, one of those follicles is the chosen one and it gets released, and that's when ovulation takes place. And then after that, the sac that's left over after ovulation, which is pretty much, you know, the leftover bit of the follicle, right? That is now known as the corpus luteum, which means yellow body. And that is what produces progesterone in the luteal phase of the cycle, which is post-ovulation. Now, if fertilization doesn't take place with the sperm, that corpus luteum actually turns into a corpus albicans, which is known as white body. So that's what will happen with the follicle. I just wanted to cover that first before we talk about polycystic ovaries, just so we've got a bit of background there. So PCO or polycystic ovaries, it actually affects about 1 in 4 women, so it's actually quite common. And there's usually a large amount of premature follicles, so they're only partially developed. They don't actually reach that Graafian or mature follicle stage, okay? They're only partially developed in your ovaries. And the word polycystic actually translates to many cysts or multiple cysts, because they're due to the sort of amount of those follicles that are in the ovary, it can actually cause the ovaries to become quite large as well, because there's quite a number of them there. So hormone wise, the research actually indicates that women that women that do have PCO, so polycystic ovaries, don't quite have PCOS, okay? However, there can be an imbalance of girly hormones, but just perhaps not to the extent of PCOS. So we'll discuss that a little bit more. So how is polycystic ovaries diagnosed? Basically, it's done through an ultrasound. That's how it's found out. And it will show multiple immature follicles, as I mentioned before. So they're not quite developed. They haven't quite matured yet. So the diagnostic criteria of polycystic ovaries, or PCO, is based on the Rotterdam criteria. So there needs to be 12 or more cysts measuring 2 to 9 millimeters, okay? And so what are the symptoms of polycystic ovaries? Well, that really varies from woman to woman. You could be asymptomatic, which means that you've got no symptoms there. And it might just be that, you were going in for something else, you had an ultrasound of your ovaries, and it was just found out that way. But for some women, it actually does cause symptoms for them. So they could be getting irregular periods. They could be getting anovulatory cycles, which means that ovulation hasn't taken place during that menstrual cycle. There could be mild pelvic pain as well. That could be another symptom. So how does this happen? How does polycystic ovaries happen? It is thought that PCO may actually develop due to high estrogen, high androgens, so male hormones, so hormones like testosterone, due to high luteinizing hormone. And there can be high androgens as well due to high insulin levels. So insulin is pretty much managing high glucose levels in the body. It's sort of managing that. So when there's insulin resistance, it's kind of given up. It's given up on the management of high glucose, okay? So as a result of the high insulin, this can actually lead to a lack of ovulation and cysts forming. So that's what happens there, okay? So what are the risks? So the risks of having PCO can potentially be type 2 diabetes because there can be that insulin resistance there, or issues with blood glucose levels, even if you've just got the polycystic ovaries. And there's lots of research to support that as well. There's a bit more of an understanding about it, but there's still more to be done. And sometimes, a lot of the concepts are kind of, how would I describe it? Some people think, oh no, you don't have any symptoms and there's no hormonal imbalance, whereas other people think otherwise. But there is research to support what I've spoken about today. So let's compare it then to Polycystic Ovarian Syndrome. So what is PCOS? So PCOS, or Polycystic Ovarian Syndrome, is a condition or a syndrome that is a collective of symptoms and signs, okay? So each individual is a little bit different and unique in the presentation of a syndrome. And it's diagnosed in 1 in 10 women, so not as much as the polycystic ovaries, remembering that was 1 in 4. This is about 1 in 10 women. It's still quite a lot though. So it's known as a metabolic condition where there's commonly hormone imbalances, whether it be insulin, glucose, testosterone, estrogen. There can be issues with thyroid hormones, pituitary hormones as well. So there can be a lot happening. It's a multi-glandular condition. So when we think of PCOS, we can't think of it in isolation as in, it's just to do with the ovaries, because it's definitely not. There's more than one hormone producing gland that's actually involved in the condition. So if you imagine a 5-legged stool, I know it probably doesn't exist out there, maybe it does, but if you imagine that, and each sort of leg of that stool is all the different glands that are involved. So it's kind of like PCOS. So it does involve the pancreas, which is the management of blood glucose and insulin, etc. It does involve the adrenal glands, which sit on top of our kidneys, and they're involved in energy production and the management of stress. It does involve the thyroid as well, which produces our thyroid hormones. And it does involve the pituitary gland in the brain as well, and the ovaries, of course, last but not least. So what are the symptoms of PCOS? So there can be a lot. Some people have some of these and some people might have all of them. So these are some of the things you may experience. There could be acne, oily skin, male pattern baldness or hair thinning. There can be hirsutism, so that's sort of unwanted hair growth in areas like the upper lip, the chin, the chest, on the boobs, on the nipples, for example. There can be weight gain around the middle, so the midsection of the abdomen there. There can be a darkening of the skin for some individuals. There can be skin tags. There can be pelvic pain. There can be sort of PMS-like symptoms leading up to the period, so about a week before. There can be anovulatory cycles, which means that ovulation doesn't take place. There can be irregular menstrual cycles, so whether they be sort of irregular or inconsistent periods, or there might be amenorrhea, so there's an absence of periods, so they're missing in action. So how does PCOS happen? It's actually quite similar to PCO. So again, there can be high estrogen, there can be high androgens, which is your male hormones, especially testosterone, particularly due to that high luteinizing hormone. There can be high androgens due to high levels of insulin in the body. And this high insulin, remember, that will lead to a lack of ovulation, because high insulin, high glucose cause a lot of inflammation, which causes hormonal imbalance. And then if ovulation doesn't take place, the cysts are formed, okay? So what are the risks? So there's quite a few risks with having PCOS, which is why it's important that it's managed. And it's mainly due to the high insulin and high glucose. So these can be things like diabetes, cardiovascular disease, obesity, things like that. So it's very important to get it under control. And dietary and lifestyle advice is very, very important in terms of PCOS and PCO potentially, depending on what's going on for that individual. So how is PCOS diagnosed then? So this is where the difference comes in. So remember, polycystic ovaries are diagnosed via ultrasound, but PCOS is a little bit different. So in order to have PCOS, it's generally diagnosed based on the Rotterdam criteria. So you need to have 2 out of the 3 following things. So you need to have 2 of these, okay? Polycystic ovaries discovered on ultrasound. That's number 1. 2, there could be symptoms and signs or blood test evidence of having high androgens or male hormones, okay? So, signs or symptoms are what I spoke about earlier. So hirsutism, that unwanted hair growth on the upper lip, chin, boobs, nipples, the little snail trail on the belly, things like that. Or there might be evidence of those being high in a blood test. And the third one is oligoanovulation. So that could be irregular ovulation, ovulation not taking place, and the menstrual cycles might be longer than 35 days. So 2 out of those 3 things. So can you see now that if you only have polycystic ovaries, that does not mean that you have polycystic ovarian syndrome. You have to have 2 out of those 3 criteria for you to actually be diagnosed with polycystic ovarian syndrome. And if this has been the case, and I find with my patients, it definitely has been the case for them, they've been diagnosed with polycystic ovarian syndrome just based on having polycystic ovaries, and that's it. But you need to look at, are there signs of increased androgens, so those male hormones, whether it be in symptoms and signs or through pathology, Or is there evidence of long menstrual cycles, lack of ovulation? Is the menstrual cycle longer than 35 days? We need to look at those two. So it needs to include one of those two as well if you've got polycystic ovaries. But you can have polycystic ovarian syndrome without having polycystic ovaries, okay? So, yeah, very, very important. And I see it all too often. And I also see, patients coming in and they say, oh, I've got polycystic ovaries, but the diagnosis of PCOS is undetermined. And I'm thinking, okay, well, there's the Rotterdam criteria. So, it will be a gynecologist or GP that will generally diagnose conditions. Naturopaths don't do that. So if that's the case for you and, it's kind of inconclusive, I would suggest seeking another professional opinion from a medical practitioner like a GP or preferably a gynecologist because they specialize in hormones and girly hormones and things like that, and that's what they do day in, day out. So get another opinion if that's the case for you, just to make sure and rule it out. So what should I do if I have PCO or polycystic ovarian syndrome? So as I mentioned, it's important to get it diagnosed by a doctor or preferably a gynecologist because they specialize in that, okay? Now, some of this I already talked about, sorry. I skipped ahead a little bit. Okay, so the medical approach, what would the medical approach be normally if you've got PCOS? So it would usually tend to be, popping you on the oral contraceptive pill and potentially metformin or something similar to regulate high insulin or insulin resistance or glucose, to manage high glucose levels in the body, okay? So apart from this, you've been to the GP, you've been diagnosed with polycystic ovaries, or perhaps you've got polycystic ovarian syndrome. I would always recommend having a naturopath as part of your healthcare team. Okay, really, really, really important, especially one that specializes in periods and hormones like myself, because we can actually help support you in a holistic way. So we're looking at, what are the contributing factors to you having PCOS or PCO? We need to actually resolve those so that we can help you and decrease the symptoms, etc., and get to the core issue of why you actually have those things. So we do that through natural medicine, so herbal medicine, nutritional medicine, diet and lifestyle, to address those root causes and get down to the bottom of it. In terms of assessment, a naturopath can actually refer you off for hormone testing. Perhaps you've already had them done by the GP or your gynecologist, which is great. We can actually have a look into those and see what your levels are like, because naturopaths actually look at testing very differently to a GP or a gynecologist because they're trained from an emergency room perspective, so they treat symptoms and disease. So the range on a pathology test is very broad, and if you fall outside of that range, that's generally when a doctor or a specialist will take action. Whereas a naturopath is more working on preventative healthcare and also looking at optimal levels within the range. So you've got the broad range, and then within that range there's an optimal range. So we generally like to see you between that range, just to make sure that things are healthy and your hormones are balanced and all that kind of thing. Which is why when sometimes you'll go to a GP and they'll say that everything's normal, and that's because they're trained to look at it to look at that broad range, whereas a naturopath will say, oh, you're kind of falling out of those optimal range, so let's do something about that before it becomes an issue. And for some people it already is an issue as well. You still can present with symptoms if your results fall out of that optimal range. The other thing that we'll look at is gut health testing as well, which is extremely important when you've got high insulin, high glucose, if you've got polycystic ovaries, polycystic ovarian syndrome, because there's been numerous studies that have shown that there's a dysbiosis in the gut, whether it be in the large intestine or the small intestine or both, when you have PCOS and PCO. Because a lot of bad bacteria will actually feed off this high glucose in the body, and it provides a lot of fuel for them, and it causes a lot of inflammation in the gut as well, having that high glucose, high insulin scenario. And when you have that, that can cause damage to the lining of the gastrointestinal tract, and it can lead to bacterial imbalances. Another useful thing might be looking at the vaginal microbiome as well. So we have a family of bacteria in our vagina, and that can become imbalanced as well. So it's nice to actually look at that and see what's happening there if it's relevant for your presentation. And that's generally a cervical swab. So you'll get that done and that will get sent away. The gut health testing, I'll just go back a bit. The gut health testing just sort of depends what your symptoms are. So there's two different tests. There's one that will look at the small intestine, and that's looking for SIBO, so small intestinal bowel overgrowth. Whereas the large intestine, and the SIBO one is a hydrogen or methane breath test, so different kind of test. And the large intestine test is actually looking at, examining your poo essentially and seeing what bacteria there. Is it good? Is it bad? Is it high? Is it low? Is there inflammation there? Is it affecting your immune system? Is it affecting your ability to detoxify? Remembering that there's a family of bacteria in the gut that will actually manage estrogen levels in the body. So it's also important to be looking to see if there's any gut dysbiosis or bacterial imbalance, because if there is, it's going to be difficult for that bacteria to actually gently escort too much estrogen out of the body, so there won't be effective clearance of it. And also for the management of the levels of estrogen as well. It's super, super important to be looking at that. And it's very, very thorough actually, that test that I do, the gut health one. The vaginal microbiome one, that's looking at a cervical swab. So it's just a vaginal swab. So it's looking at the bacteria there, okay? And the reason why I recommend seeing a naturopath is because using the oral contraceptive is just not a good long-term strategy. It's going to stop the production of your girly hormones. It's going to stop you ovulating. So it's going to look like you've got a regular cycle, but it's actually stopped the production of your hormones. So basically what you're getting is a withdrawal bleed. You're not actually getting a period when you're on it. And usually when you come off that pill then, the symptoms of PCOS come raging back because you haven't actually addressed the underlying root cause of it. So it simply isn't a very good long-term strategy to be doing. That's why I recommend seeing a naturopath as well. You need to address the reasons why it's actually happening. So all the things I spoke about before, is it high glucose? Is it high insulin? Is there high male hormones like testosterone? Is there high estrogen? Is there gut issues that are preventing it from being, estrogen from being cleared from the body? Is there liver issues? So that's involved in breaking down hormones. Is there an issue there? We need to look at all the organs of elimination to make sure that hormones are being broken down properly and taken out of the body. Otherwise, it's just going to fuel that PCOS and contribute to all those unwanted symptoms that you experience. So usually when you see a naturopath, for me personally, I usually use a combination of herbal medicine, nutritional medicine, diet and lifestyle advice. I also use a technique known as naturopathic emotional release, which works on underlying emotions or stress that's contributing to your PCOS, which is really, really important because we can give you physical treatment till the cows come home, but if there's something underlying and it's underlying stress or underlying emotion, you could still be, presenting with sort of PCOS symptoms as well. Does anyone have any questions just before I finish up as well? I'm just going to check Facebook as well. Okay, no problem. So if you are experiencing PCO or PCOS, or maybe you think you might have one of those, I would absolutely love to help you. So I'd like to invite you to a 15-minute free discovery call, where you can sort of work out if we're a good fit, what the treatment would involve, and any other questions that you have. So there's a link in my bio if you're on Instagram. If you're watching on Facebook or YouTube, I'll pop the link down below for you. So yeah, if you're struggling with that, just keep that in mind. Now, remember that all my Instagram and Facebook lives that I've done are actually all on my website. So I do a blog each week and I pop the video up the top and then I pop the written version underneath as well. Some people are very visual and they like to see it all written out. So that will all be on there. So if you head to reproductivewellness.com.au/blog, there'll be all of those videos and information there. I've also got some, I have a blog that I did. I was interviewed by Suno, so TSUNO, which is a company that make bamboo pads. And they actually interviewed me on the difference between PCO and PCOS. So you might want to check that out. I'll pop a link for you on Instagram in the bio. But otherwise, if you head to my blog, I'll pop that link down the bottom of that particular blog as well, okay? So yeah, it's been an absolute pleasure talking to you this evening, and thank you so much for watching. I really appreciate you. And FYI, I go live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about something period, hormone, women's health, or menstrual cycle related. So I really look forward to seeing you next Wednesday. If you're watching on my YouTube channel, be sure to like and subscribe. Thank you so much.